on impact bonds and what does it mean, social impact, social bonds or health bonds. And in studio, I'm joined by Keegan Korir. He's the program specialist, adolescent and youth at UNFPA Kenya. Next to him is Dr. Hilda Essendi. She's a research and analytics director at TICO Africa. Thank you both for making time.
Thank you for having us.
Impact bond. What is an impact bond? What does it mean? Maybe I can start with you just to tell us what it means and how does it differentiate from a traditional bond?
All right, thank you very much. I think it's not really a new concept, if you like, and impact bonds. The way I can just be able to break it down in a simple way is it's an instrument or mechanism of financing development goals or outcomes, if you like. And just like a loan, you talk about guarantees, you talk about grants. All these are mechanisms of financing development. So an impact bond, just a departure from the normal bond that we know in the money markets and what have you. That term basically emanates from the use of agreements. It's like you're bonding and basically having agreements with multiple players towards certain results, which the payment that has been made available goes towards achieving. So it's more or less of something that ties together different stakeholders for certain development goals. Now, this is not something that's just started the other day. It's been there for some time. Currently, the UNFPA working with TICO together with the Children Investment Fund Foundation are currently implementing one of the we call it the Adolescent Sexual Reproductive and Development Impact Bond in Kenya. But this was just a second of its kind, because then we had a first one which was supported by the UK government, and basically this is more or less of a succession. So just to tie this up is that under an impact bond, you have about 3 players. So you have someone who is interested in certain development goals or outcomes. It could be the traditional donor, like the FCDO, and then you have an investor, so a social investor, just like any other investor, but then perhaps these are investors who are more geared towards social outcomes. Like in this case, you're talking about addressing teenage pregnancies, addressing the challenge of HIV among young people. So you find then that the social investor agrees with the outcome funder, in this case the traditional donor, that these are the results that we want to achieve. Then the social investor then pre-finances, uses their capital to pay for the program to be implemented by an expert in development, but this is premised on certain results. So when the results have been attained, then the outcome funder pays back the social investor with a certain premium. So it is more or less of really trying to bring on board the non-traditional players to support development outcomes like the ones I just mentioned.
Wow, very well and broadly explained. Dr. Hilda, to you now, how would you define impact bond, especially for someone who's in research specifically? How would you define impact bond even away from the traditional bonds that we know?
So like my colleague Korir has mentioned, in an impact bond, you've got 3 players. And another critical component of impact bonds, of course, is it's premised or structured across payment metrics or pay for performance. So you have pre-agreed upon metrics that the implementer, so one of the 3 players, needs to meet so that the outcome payer can pay the investor. So for me, impact bonds is just, especially working for TICO Africa, that has been the implementer in the 2 impact bonds. The first one run or supported by FCDO, and the second one supported by the various UN agencies, including UNFPA and the Children's Investment Fund Foundation as the implementer. So we are the agency tasked with meeting those objectives, meeting those outcomes as pre-agreed upon in this arrangement, so that the investor can get their payment.
Korir, coming to you as a program specialist when it comes to adolescent and youth, especially in the UNFPA, how would you say the rate of, let's say, teenage pregnancies is in Africa, for instance, statistically?
All right, so maybe I'll just start home because then this is where we are.
Right.
And just to say that teen pregnancy has really been a key issue of concern in Kenya. It's been in the conversations for quite some time. At the current rate, based on the Kenya Demographic Health Survey of 2022, it's around 15%. This is a slight decline from 2014, where we were talking about around 18%. So currently, despite the slight decline, we find that around 300,000 or 250,000 to 300,000 girls every year becoming pregnant. That's adding to almost, if you're adding around 1 million.
Right, Korir, we're going to come back to you in just a bit, but I just want to throw the same question to Dr. Hilda, like in terms of teenage pregnancy, even from the research you've done from TICO Africa, before we get into the impact side of it, what has been your observation so far?
So, recognizing that this second impact bond that we are implementing seeks to, number one, address teen pregnancies, number two, reduce new HIV infections, and number three, reduce AIDS-related deaths among teenage girls in Kenya. It is important to recognize the challenges or the fact that young people bear the greatest burden of unintended pregnancies and HIV infections. Recently released reports or research shows that young people between 15 and 24 years, really a lot of new infections are happening within this demographic. And so it's critical for ourselves as TICO Africa, with all the partners that we work with, that we are able to contribute towards addressing some of these challenges that adolescents face within the space we work in.
Speaking of challenges, would you link something like, stigmatization as one of the issues that really even puts young people away when, let's say, when someone gets pregnant and is a teenager, and actually enhances this particular issue?
Of course. So young people face a myriad of challenges, for sure, that keep them away from accessing the much needed health services, particularly when it comes to sexual reproductive health and as well as HIV. So one is cost. Cost is an element, is a factor. So whereas our research shows that a lot of young people would really like to access their healthcare in private facilities, there is a payment required. So therefore, cost becomes a limiting factor. Other factors like access becomes a challenge, but also community norms is another issue or another factor that affects young people's confidence and ability to access sexual and reproductive health services. So when you look at it broadly, as TICO Africa, we try to address some of these barriers within our work and in the structuring of the TICO work itself. So we try to alleviate or address some of these challenges that create barriers for adolescents and young people when they're trying to access sexual and reproductive health services. And I can just mention some of the ways we do that.
Right.
So as TICO Africa, we have a technology platform that enables young people, or rather it creates a platform, it acts as a platform that brings players to the table, making it easy for young people to access services. So some of these players are health providers. So we work with public facilities, private facilities, and pharmacies. And within the platform as well, so a young person can enroll onto TICO, and when they enroll onto TICO, they can select from a panel of health providers depending on their need, who to go to for healthcare services. And we also do have demand generation partners on the ground. We have community mobilizers who work with community-based organizations. We have community health promoters that really provide, create demand among young people within the community, talking to them about the range of services that they could access when they enroll onto TICO. So within that, we are able to address, some of these challenges. And of course, when they sign on to TICO, because of the support we get from development partners like FCDO, the UN teams, and Children's Investment Fund Foundation are some of our donors, we are able to provide subsidized services. So therefore, the barrier of access or cost becomes addressed at that point. So young people can come, sign up to TICO, get any service that they'd like to access without worrying about the cost, whether it's in a private facility, a public facility, or a pharmacy. So then we are able to address that barrier of cost. And then, of course, we also use mechanisms such as behavioral nudges. We try and nudge young people or work to ensure that there's behavior change within themselves, so that when you come and access a contraceptive service or an HIV service, you're supposed to come back, keep coming back to ensure that your health outcomes are guaranteed. So we will remind them if they've joined TICO on phone. We will encourage them to rate the quality of those services so that we can improve the quality of services they are receiving at the health facility. And we'll also ensure that, of course, their services are subsidized. So in that way, TICO Africa, with support from all our partners, we try and address the challenges the young people are facing in terms of accessing sexual reproductive health services.
Right. You've given it us, of course, in details what TICO has been doing, but let's talk about now like development impact bonds, the DIB, that also the UK government pioneered. Could you tell us about the first one and now where we are so far?
So the first development impact bond was, of course, supported by the UK government. And so we had 3 partners. So there is the implementing partner, which is TICO Africa ourselves. We had the investor at that point was the Children's Investment Fund Foundation, and the payer was the UK government. And because pay per performance is a critical component of development impact bonds, there had to be agreed upon indicators that they needed to be met by TICO Africa for Children's Investment Fund Foundation to be paid by the UK government. So we had 2 key indicators, and one was ensuring that we provide a certain number of contraceptive services to adolescents in 16 counties in Kenya. And then the second indicator was ensuring that we provide a certain number of repeat services to these adolescents, repeat contraceptive services to these adolescent girls. So this was an 18-month project. We implemented it in 2020 and 2021. And at the end of it all, we had surpassed, as TICO Africa, we had surpassed the indicators as had been agreed upon, such that for the first indicator, which is providing the number of contraceptive services that TICO provided, we delivered 148% of those services. And for repeat services, we surpassed that as well and delivered 262% of the repeat services. So as a result of those successes, then we got to speaking to other funders as well and other partners to structure now another development impact bond. Now, for this new development impact bond, we've got a number of players in it. So we've got, for example, the joint UN team, and that has UNFPA in it. It has WHO, it has UNAIDS, it has the SDG partnership platform. It also has the Children's Investment Fund Foundation as the payer. And within this, now the second DIB, the investor here is the Bridges Outcomes Partnerships. And so because of the successes we had had in the first development impact bond, this second development impact bond now has 5 indicators that TICO Africa, as the implementing partner, must meet for Bridges Outcomes Partnerships to be paid their investment by the Children's Investment Fund Foundation. So we've got 5 indicators now. One indicator is to ensure we deliver a certain number of contraceptive services to adolescents. In this case, we are working in 10 counties. And going beyond addressing teen pregnancies, this current development impact bond has gone ahead to also look into reducing new infections of HIV amongst teenage girls in Kenya, as well as reducing AIDS-related deaths. So we have the 5 indicators are framed around these key health areas. So number 1 is to deliver a certain number of contraceptive services to adolescent girls. Number 2 is to deliver a certain number of HIV services to adolescent girls, and this includes HIV testing, antiretroviral therapy for those who test positive for HIV or who are on treatment, and then pre-exposure prophylaxis as a prevention mechanism for those highest at risk of contracting HIV. And then the third indicator here is ensuring that for those who take contraceptive services, they are coming back, they are repeating. So there is an indicator there ensuring that we meet a certain percentage of, there's a certain percentage of girls we are reaching who are coming back for repeat contraceptive services. And there's a certain proportion of those we are reaching with HIV services that are coming back. But most importantly, so you can see, certainly for this second development impact bond, we are seeking to reach scale, but also to ensure quality, because the fifth indicator in this development impact bond looks at ensuring that we are reaching a certain percentage of girls living in multidimensional poverty, so that we are not just reaching them with services, but we are ensuring that we are reaching girls who are highest at risk or who are in poverty. So we have those 5 indicators in this new development impact bond.
Which you've explained pretty well. Now I want to just come to Korir, just to understand now what the UNFPA is doing when it comes to such initiatives of dealing with such challenges, and also the development impact bond. Give us a bit about what UNFPA is doing.
All right, thank you very much. I think, let me just say that it's not only UNFPA, because this is a joint program that involves multiple UN agencies. But as it were, we are a technical partner in this development impact bond, but also now as UNFPA, we act as the anchor outcome funder. So basically, we are collating the overall outcome payments that are then supposed to be paid back to the investor who is investing in TICO to deliver the services. Now, and I think you've heard from this conversation here today that a lot of what Dr. Hilda here has alluded to is about results. It's all about results. She's talked about the number of girls that are supposed to be reached, the number of services that are supposed to be delivered, looking at the girls who are in multidimensional poverty. So it's all about the impact. That's why it's called a development impact bond. And so UNFPA, for instance, acting on behalf of the other outcome payers, we are only going to make the payments to the social investor that has invested the money in TICO only once we verify that the services have been attained and we are satisfied that actually the girls have been reached, then we pay back the money. So it is a pay for success kind of an initiative. And so basically, unlike the other development programs where you have grants and what have you, where it's a lot of emphasis on processes. In this case, we emphasize just on results. If we don't achieve, we don't pay. So that's the dynamic of the bond.
So which means you're focusing on the outcome of what?
Exactly.
Yeah, so if I was to ask even the expectations that you have out of this, the DIB now, the second bit, like it will just be focusing on the results.
Absolutely. And of course, the overall picture really for us is, are we able to use this investment to change the tide on teen pregnancies, to change the tide on new HIV infections, but also ensuring also that we don't lose our adolescents because of HIV-related issues and complications. So the emphasis, just besides the low-level outcomes of the people that have been able to access the services, because ultimately for us, we want to, at least in a period of 2 years, our ambition is to reach up to 500,000 girls with critical services. But these are just not girls. We are targeting actually 10 counties with a high burden of HIV and teen pregnancy. So ultimately, it's really to contribute to the national conversation, not only around reducing teen pregnancies, but also ultimately, because then Kenya being a lower middle income country, there's been a lot of decline in foreign development assistance. That's why you talk about all this innovative financing. We have to look for alternative mechanisms really of complementing the traditional mechanisms. And that's why for the bond, why it is important is that we are able to really attract investments, private investments into social outcomes. And that's why the thinking is that as we really continue scaling up the heights as a lower middle income country, can we be able to attract other forms of investment to change the social outcomes that we are trying to achieve.
Right, very interesting. I think I've also learned a lot out of this, and I hope we'll be able to have this conversation once the results are out, right?
Absolutely.
Right, thank you so much. That is Kigen Korir. He's a program specialist, adolescents and youth, UNFPA Kenya. And also we had Dr. Hilda Essendi. She's a research and analytics director at TICO Africa. Thank you both for that.